Psychotic disorders are an exam favorite, and you have to know how to distinguish them quickly. Schizophrenia is a big one. In order to diagnose with schizophrenia, there must be at least 2 or more symptoms for at least 6 months. There must be at least one of the following: delusions, hallucinations, or disorganized speech. And they can also have grossly disorganized behavior or catatonic behavior and negative symptoms. So that duration is a big deal. You have to know that these symptoms must last for at least 6 months, and these include both prodromal and residual periods as well. So if you have a person with prodromal symptoms for, say, 3 months, and then they have positive symptoms for 3 months, they meet criteria for schizophrenia. People also tend to socially isolate and have significant impaired function. So let's talk about the key positive symptoms so that you know what they are on the exam. First, there's delusions. So delusions are fixed false beliefs that persist despite evidence to the contrary, and they are not shared by that person's culture. These can be divided into bizarre and non-bizarre. So bizarre delusions would be impossible, like aliens spying on them through telepathy, whereas non-bizarre delusions are plausible but untrue, like neighbors spying on them with cameras. Then there's hallucinations. These are sensory perceptions occurring without an external stimulus. So auditory are the most common in schizophrenia. Ideas of reference are beliefs that an external cue are uniquely related to the individual, such as TV characters speaking directly to the patient. And then a thought disorder is disorganized speech, thought process, loosening of associations, word salad. I mentioned negative symptoms, and you do need to know what these look like for the exam. So there's anhedonia, which is a loss of pleasure. There's a flat affect or blunted affect. Allogia, which is a poverty of speech. And avolition, which is a lack of interest, lack of drive, and poor attention. So incredibly high yield for your exam is the difference between brief psychotic disorder, schizophreniform disorder, and schizophrenia. So the main difference between these three is the timeline. So for a brief psychotic disorder, they're going to have psychotic symptoms for 1 day to 1 month. And then for schizophreniform disorder, they are going to have symptoms that meet criteria for schizophrenia for 1 month to 6 months. And then for schizophrenia, they're going to meet full criteria, and it's going to be for at least 6 months. I get a question on what makes someone's prognosis better or worse, so I do recommend you read through this list. So for a better prognosis, there is going to be a later onset, female gender, good social support, acute onset, positive symptoms, and good premorbid functioning. Whereas worst prognosis is the opposite. So that is going to be a earlier onset, male gender, poor social support, gradual onset, negative symptoms, and poor premorbid functioning. Let's talk about schizoaffective disorder. They do like to test you on this versus mood disorders with psychosis. So this is a mood plus psychosis disorder. And in order to meet criteria for schizoaffective disorder, they must meet criteria for major depressive or manic episode concurrently with psychotic symptoms. The crucial distinguishing criterion is the delusions or hallucinations must be present for at least 2 weeks in the absence of mood disorder symptoms as well. And this is the key distinguisher because in a mood disorder where there is psychosis, the psychosis only happens with the mood symptoms. So pay attention to the symptoms and the timeline of those symptoms on the exam. Mood disorders with psychotic features tend to be on the differential on the exam with schizoaffective disorder. Psychotic symptoms that occur during either the depressive episode or the manic episode are usually mood congruent. So in MDD with psychotic features, the psychosis is themes of paranoia, guilt, or worthlessness. And then in bipolar disorder with psychotic features, the themes tend to be grandiosity or invincibility. Now we'll talk about delusional disorder because it does tend to show up on the differential on the exam. So delusional disorder is characterized by 1 or more delusions for at least 1 month. And the crucial distinctions from schizophrenia is delusions are usually non-bizarre, they're plausible, and the functioning in life is not significantly impaired. Remember, with schizophrenia, there is severe impairment, whereas with delusional disorder, they can live their everyday lives. And behavior is not obviously bizarre. There are various different types of delusional disorders, including the erotomanic, grandiose, somatic, precursatory, jealous, mixed, unspecified. Examiners do like to test on psychotic disorders due to another medical condition because we are supposed to rule out any medical conditions before diagnosing with a primary psychotic disorder. And you can see hints of this in the vignette through the person's history, physical labs that might support a medical cause. And common medical causes that they like to test on are the CNS diseases like stroke, MS, epilepsy, encephalitis, endocrine issues like hyper or hypothyroidism, nutritional deficits like B12, folate, autoimmune diseases, and of course, delirium. They also like to test on substance or medication-induced psychosis, and common causes are alcohol withdrawal, delirium tremens, stimulants like cocaine intoxication, hallucinogens like LSD or PCP, and cannabis. A big one for medications is steroids. So you'll have someone that's taking prednisone and comes in psychotic. It's probably due to the steroid. To test yourself on these disorders, click on the psychotic disorder question video. Subscribe for new videos every week.